Maintaining hygiene, eating patterns, and a strong immune system by exercising routinely are the keys to keeping ourselves fit during the ongoing pandemic. Various vitamins have also become mandatory supplements in boosting the body's immune system, one of which is vitamin D, which has an integral role and massive benefit in fighting internal inflammation. Aside from providing benefits for our bones, fulfilling our need for vitamin D is highly recommended, as it plays a vital role in dictating how the immune system combats the coronavirus. Vitamin D can also be obtained through food and basking in the sun. However, we also need to know the correct time to bask in the sun. We also need to know what food contains vitamin D and the amount that our body needs, since each person requires different doses of vitamin D. So we will talk with orthopedic surgeon Dr. Suhendra to find out more about the amount of vitamin D that we need on a daily basis. Stay tuned on the C Morning Show.
Yes, a Boston University doctor in September 2020 said to the Boston Herald that a sufficient amount of vitamin D can cut the risk of catching coronavirus by 54%. Dr. Michael Hollick, who is also a scientific advisor to the Vitamin D Society in Canada, said that vitamin D definitely improves your overall immunity to fight infections.
54%, that is a huge number. And here to share his insight on the numerous benefits of vitamin D on our overall health, especially during the pandemic, and maybe to dispel some myths, rumors, or misinformation, is Dr. Suhendra, an orthopedic surgeon who is also the head of the Vitamin D Society Indonesia. Good morning, Doc. Thank you for joining us here. Yes, thank you so much for joining us here on the C Morning Show. Thank you for waiting as well. We've had you online for quite a bit, but as you've heard Marissa just say, vitamin D can cut the risk of catching coronavirus by 54%. Tell us, is this true? Is this not true? Is there some sort of stipulation to this that we need to know?
Yes, exactly. I'm very glad that she mentioned Dr. Michael Hollick, because we will start from Michael Hollick. You know, there are a lot of confusions going on, even about what is the best time to go sunbathing. And there are still people out there who believes, not only lay people, but some doctors too, are spreading the news that the best time for sun bathing is around 8 to 9 in the morning, which is completely false. Yeah, and to that I would say Dr. Michael Hollick came to Jakarta to do his study about the best timing to have sunlight to produce your vitamin D in your skin, and the result was, it was printed in the journal. So whatever I would like to say is to my fellow doctors, please read your journal. In 2012, Dr. Michael Hollick came to a conclusion that the best timing for sunlight in Jakarta, I repeat myself, in Jakarta, because you know what, several doctors even fights against me, saying that Henry is saying something wrong, because that must be in US or somewhere. But it was actually in Jakarta, and he concluded that the best timing is from 11 until 1 p.m. 11 until 1 p.m.
Right.
Yes. Okay. Actually, if you follow my IG, I also gave a different number, a little bit of different number, because I'm giving you more time from 10 to 2 actually,
yes,
10 a.m. to 2 p.m.
Yeah.
The way to know for sure that you're getting enough vitamin D is actually looking at your shadow. If your shadow is shorter than your height, then you're still getting enough vitamin D. But
so the sun is above us.
Yes, because the best timing is midday, 12 o'clock.
Okay, so that's a simple way to just identify whether it's the right time to be out. And I'm so glad you mentioned this, Doc, because I like to take my kids out to we have a pool in our housing complex, and I always take them out closer to midday because I like to, I like my kids to be a little bit more tan, and the pool is less busy because everyone's, out there early morning, and then everybody just runs and hides back in their homes by 10 p.m. exactly, and I could count by my watch exactly by around 3:30 or 4, everyone will start coming back out to the pool. So I use that midday when the pool's empty to go out, and people are always telling me you shouldn't take your kids out during the day because you're
but be very careful. Be very careful because all you need is around 5 to 10 minutes. You want to avoid sunburn as much as possible.
Right. Okay. Overexposure.
All right, doctor. And also, can you please confirm whether what Dr. Michael Holick said was true, that it can cut the risk of catching coronavirus by 54%?
Exactly. I would confirm that. In fact, in September 2020, another professor, an internal medicine by the name of Professor David Meltzer. Meltzer is, I think the spelling is Meltzer. Meltzer from University of Chicago, stating that if you have a deficiency of vitamin D, so your chances of getting a COVID-19 is 77% more than someone who has a good blood level of vitamin D.
Wow, that's huge.
So the problem is our lab is showing not so correct number, because it is stated that sufficient to have 30 to 100. Actually, it's not sufficient. It's not sufficient. So the guideline is not very updated, because we are now using a different guideline from Vitamin D Council USA, which states that 40 to 80 nanogram per mil is sufficient. Right. Remember, 40 to 80. But you want to reach 80 to 100, which is normal high or optimal. You want to be optimal to fight COVID-19.
Right, and how can we know how much vitamin D we have in our body? What sort of test do we have to have?
Yeah, simple blood test. You just go to any lab and then ask for vitamin D, blood test of vitamin D. It takes about, I think, 5 hours to have the result back.
Okay, so it's a specific test that we can get in order to know how much our vitamin D levels are in our body. And at this time, in the middle of this pandemic, it's advised that we should have more than the normal average amount that we normally have.
Yes, and
so that's the right step is to check your blood level regularly, because as you take whatever you do, you can take a certain food. You can go to have sunbathing, and then you can take a supplement. But at the end of the day, the most important thing is your blood level. Okay. So check your blood level, like in 2 months or 3 months.
Right. You've mentioned before in a previous interview of you that I've watched, doctor, that there is an effect of vitamin D on COVID patients. So how much vitamin D does a COVID patient need to help them recover faster from the illness?
Okay, since this COVID-19 is quite a new disease, so nobody is really an expert on COVID-19. But from the experience, I would say, this is my own relatives. Both of them, they got sick when traveling. And then when I asked what blood level of vitamin D do you have at the moment, and then they came back with a figure of 69 and 70. Remember, 69 and 70 nanogram per mil in their blood, and they're still contracting COVID-19. Okay. Remember, from the guideline, 40 to 80 is sufficient actually. Yes. But the guy that had 70 nanogram per mil got infected, but surprisingly, the wife who stays at the same room, sleeping together, the wife negative. The wife was still negative, and vitamin D blood level was 117.
Wow.
So
Okay.
the vitamin D really protected the wife.
Okay, Doc, I want to follow up on that. Can you have too much vitamin D in your body? Obviously, she's above the optimal 80 to 100 range. Is that too much?
No. It's actually, what I said just now, 80 to 100 is optimal.
Right.
But people always ask about toxicity.
Right.
Toxicity, don't worry about toxicity, because toxicity will happen only when you have 300 nanogram per mil.
Okay.
300, which is quite impossible to reach.
Right.
But to be on the safe side, vitamin D experts from many countries have sat down and then decided arbitrary decision that toxicity is designated as 150. But actually, if you go over 150, it is still safe, because the real toxicity is 300. I always keep my own blood level over 100.
Okay.
110, because there's another doctor from Texas, Dr. Judson Somerville. Somerville is Sumerville,
Okay.
from Texas, who advised us to have a clinical optimal blood level of vitamin D as much as 100 to 140.
Right.
So below 150, you're okay.
Okay.
You know, you feel great.
Yeah.
Once you reach 100, you feel great. You become a totally different person.
Doc, I want to ask you, because you mentioned a lot of
I'm
different
66, but by the way, I'm 66 years old.
You don't look a day over 56, Doc. I want to ask you a little bit about how we get our vitamin D. We've mentioned the sun. We've mentioned there's obviously different sorts of foods that we can all just research and find out where they come from. Plus supplementation. What would you recommend as to the balance of how we should get this? Like a little bit from everything, or one particular thing better than the other, such as food?
Yeah. Because there are a lot of studies, confirming that anyone cannot achieve around 100 nanogram per mil of blood level only from sunlight and from food.
Okay.
Yeah. So you can go out anytime you like. You can eat whatever you like, but you still need supplementation of vitamin D.
Right.
To make your blood level reach around 100.
So
because it is impossible.
There are several selections out there available, Doctor. There are several selections available out there. For like what I consume personally is vitamin D that consists of 1,000 IU, and then if I look at the marketplace out there, some shops actually also sell the mega dose, which is the 50,000 IU per pill. It's available in Indonesia. It's available internationally.
Yes.
So what is your suggestion? Yes. How much IU should we take?
Okay. First of all, let me surprise you. I'm taking 10,000 to 15,000 each day.
Whoa.
Okay? Don't be surprised, because according to Vitamin D Council USA, with the headquarters in California somewhere, stated that starting dose should be 5,000 to 10,000 IU.
Right.
5,000 to 10,000 IU. If you're taking less than 5,000, it's a joke.
Okay.
All right?
Right.
Because what? You need 5,000 to 10,000 to be able to reach 80 to 100 in your blood. Because if you're taking less than that, it is useless. It is useless.
Okay.
So, but one more thing is more important. When you're taking a 5,000, be very careful. You need to take also vitamin K2. Vitamin K2.
Potassium. Okay. Oh, it's different.
No, it's not calcium or potassium. It is a vitamin.
Okay.
K2.
K2.
Okay. Kilo 2.
Okay.
Yes. Because when you take at least 5,000 D3, there's a chance of getting too much calcium in your blood. Because vitamin D works by increasing the absorption, the intestinal absorption of vitamin D as much as 20 times. So you have a lot of calcium in your blood.
Well,
so
and you have
need
a lot of
vitamin
calcium.
K2.
Right.
You need vitamin K2 to clean up all the calcium and bring it to the place where it should be, and that's in the bone.
Okay,
Right, doctor.
Doc.
And if you have too much calcium in your blood, what happens to our body?
You get blood vessel, especially in your heart.
Oh,
you
man.
get kidney stones. You get stones in your arthritis in your joints, and so many things.
Okay,
But
we're going to talk a little bit more about calcium because as it relates to bone health as well. But Doc, we're going to keep you on the line.
Yes.
We do have to take a short break. Don't go anywhere. We've got much
Right.
more to come with Dr. Suhendra here on the morning show. Stay with us after this. I'm going to take my 5,000 so I can look like the doctor.
K-12.
Yeah.
With K-12.
We'll be back.